Hey, hey y'all. How you doing? I'm Dr. Gheraibeh. I work here at Carolina Orthopedics. I'm a general orthopedic surgeon, and I do total knee replacements and total hip replacements for knee and hip and arthritis, and that's what we're going to talk about tonight. If you guys have any questions at any time during the talk, feel free to stop me, ask me. This is very informal, okay? All right. So we're going to talk about degenerative joint disease or osteoarthritis or regular arthritis. It all goes by these names. And what it is the irreversible destruction of the articular cartilage of the joints. And these can be caused by one thing or a combination of these things. I've kind of listed the most common things. Genetics, that's kind of a hot topic right now. Like I saw a commercial for something called 23X last night on TV where you can get your genome basically and look at it and see what diseases you're predisposed to. I don't know if that's necessarily a good idea because there's a lot of other things that go into disease besides genes. But as far as arthritis goes, there are a lot of genes that are related to arthritis, and it's a very complicated inheritance pattern. We do know that it runs in families, but we don't know exactly. It's not necessarily if your mother had it, then you're going to get it, that sort of thing, but it does run in families. Trauma, if you have a fracture at some point during your life and the break extends up into the joint, it can damage the cartilage, and that can lead to arthritis later on down the road. Avascular necrosis happens when there's a loss of blood supply to the bone right up underneath the cartilage, which causes the bone to collapse, and it causes deformity of the joint and early wearing out of the cartilage. This is most commonly seen in the hip. It's seen usually in men in around their 50s. And the most common reason is we don't know why it happens. It just happens. It's seen in people with sickle cell anemia. It's seen in people that drink a lot of alcohol every day. And it's also seen in other blood disorders. But like I said, the most common reason is idiopathic. We don't know why, but it's fairly common. Other disorders can cause bleeding into the joint, which basically causes irritation and the lining of the joint to destroy the cartilage. Hemophilia is a common one, and hemochromatosis is a common one. So normal healthy joints. So the cartilage is very smooth. The cartilage that we have that we're born with is slicker than ice, so it can rub against each other and it doesn't cause any pain, and it allows the joint to move smoothly. The bone underneath the cartilage is healthy, it's nice and strong, it's not worn out. And there's a small amount of joint fluid present in your joints when they're healthy. When you have arthritis, you may have swelling and more fluid in the joint. That can be one sign of arthritis. But cartilage doesn't have any blood supply, so it's kind of like your heart if you have a heart attack, or your brain if you have a stroke. Once you lose it, it's gone, and there's no good way to put it back. So it's important to maintain your range of motion to move this fluid around in the joint, because that's how your cartilage gets its nutrition. So these are what a normal healthy knee and a normal healthy hip look like. So if you look here, this is your knee, and the kind of white bluish stuff is the cartilage, which lines the end of the joint. This is the femur or the thigh bone, and then the tibia or the shin bone, and in the middle it meets and makes your knee. And there's ligaments that surround it that give it support. These can be worn out in cartilage that can or in arthritis that can cause deformity, which we'll talk about later. In the hip is more of like a ball and socket joint. So you'll see there the femur or the thigh bone is the ball, and the pelvis and the acetabulum is the cup. So a joint with arthritis or DJD, the cartilage is eroded and the joint space narrows down. So the space that we talk about is actually where the cartilage touches each other, but on the x-ray, the cartilage doesn't show up, just the bone. So if you see a space, that means you've still got some cartilage left. When the cartilage wears out, the bone is exposed, and when the bone rubs on the bone, that hurts because that's not supposed to happen. So that's your body's way of telling you something's going wrong. And the joint doesn't move slowly, so you can have symptoms like catching or locking or like it's going to give away. The joint will also start to form osteophytes, or what you hear are called bone spurs, which are basically little extra pieces of bone at the edges from the bone rubbing against each other. And sometimes these can break off and you can get a loose body, which is kind of like the equivalent of having a pebble in your shoe. So if you can imagine like this rock in your joint and it moving around, and it can lock it and make it click and pop, things like that. So this is a knee and a hip that have arthritis. So if you look at the knee, you see the whitish blue cartilage is starting to wear away, and you can see the bone underneath, and all these little bumps are the bone spurs that are made. Same thing over here in the hip joint. You can see the space is getting narrow and the bone is touching the bone. So this is a kind of a cool picture. This is, you may have heard of these procedures, arthroscopy or minimally invasive procedures, where you can go in and clean up the knee. Those don't necessarily work so well unless you have a loose body that's causing problems, and you can take that out. But this shows you a good picture in a real person, so you can see the femur or the thigh bone, the end of it's at the top, and then the tibia or the top of the shin bone is at the bottom. And the white stuff is the arthritis, and then the kind of yellowish tan stuff is where the arthritis has happened, and the cartilage has been worn away, and that's exposed bone. So you can imagine when you roll these together, that bone's going to touch that bone, and that's going to hurt. This is a good picture of a loose body. So see what I mean by a pebble in your shoe? That thing gets stuck in the middle and in those ligaments, and that can cause locking of the knee, popping, giving away, stuff like that. And there's a picture of it with the arthroscopy again. So you can see it's kind of like a cartilage covered piece of bone, and we're not really sure where these come from. We think maybe they're osteophytes or bone spurs that break off and get loose in the joint, but they do happen. Okay, so I have some videos. All right. So this is a video from the American Academy of Orthopedic Surgery. They have a great website for patient education, and that's where a lot of this material is from. So you can go to that website and look at a lot of videos and learn a lot about the procedures that are done for arthritis. So this one is a healthy knee.
The knee acts like a hinge and a shock absorber when you walk, run, jump, kick, or climb. Ligaments, tendons, and muscles give the knee stability and hold it together. Rubbery tissue called cartilage covers and cushions the ends of the bones that make up the knee. These bones include the femur or thigh bone, the tibia or shin bone, and the patella or kneecap. Osteoarthritis of the knee means the cartilage in the joint has broken down because of excessive wear due to obesity, injuries, or overuse. It is also called degenerative arthritis and degenerative joint disease, or DJD. When knee cartilage is rough, frayed, or worn away, the bones can grind against each other, which can make the knee joint irritated, painful, and swollen.
Pretty good, huh? Everything I just said. I think videos and pictures explain things better. So here's one of the hip.
The hip joint is a ball and socket joint. This type of joint, with a ball-shaped bone fitting into a cup-like socket, permits the leg to move in a full circle or 360 degrees. Smooth cartilage covers the surface of the bones to protect them, reduce friction, and ease movement. Osteoarthritis of the hip occurs when wear and tear on the joint causes this smooth cartilage to wear away. As the bones rub directly against each other, they can be damaged, and small growths called bone spurs may develop. These changes can cause pain, stiffness, and difficulty moving, and limit the leg's range of motion.
Okay, so symptoms of arthritis. So things that patients come and tell me that are bothering them. So stiffness, especially after they've been sitting in a chair for a long time, or they've been sitting in a car for a long time. When they get up, they're kind of like, ugh, and they have to stand there for a minute, kind of let it work it out, and then you can kind of get going. Swelling, so you'll see this more in the knee. The hip is a very deep joint. Your hip's actually here, like in your groin. The most common pain with hip arthritis is groin pain. A lot of people think the hip's out here. It's not. It's way down deep here. So you won't really see any swelling with hip arthritis, but you will see it with knee because it's very superficial. There's nothing really covering it much but skin and a little bit of fatty tissue. So you can sometimes get some swelling. Popping, clicking, and locking, like we talked about, the loose fragments of bone or cartilage can move around in the joint. And pain is the main thing. You know, when you're up walking around or weight bearing where you're having to actually put pressure on that joint causes pain. So certain activities, especially getting in and out of a car with hip arthritis seems to bother people a lot, turning over in bed. Any kind of twisting movements can hurt with the knee. And then you can have giving out, where the joint will feel unstable and weak. Sometimes the arthritis can progress so much, particularly in the knee, that it can make you either bow-legged or knock-kneed, varus or valgus, but bow-legged and knock-kneed is a little bit easier to understand. And that happens when you wear out one side of the joint and the ligaments on that side get really tight, and it loosens up the ligaments on the other side, so you get a deformity, and I'll show you some pictures of that. You can also get to the point where you can't straighten your knee out all the way, which is called a flexion contracture. You can get this in the hip too. So there's a picture of swelling. So you see the knee on the left-hand side, you can kind of see the outline of the bones and the joints, and then on the left, it just kind of looks like a balloon. When that happens, you can do an aspiration, which is basically where you numb up the side of the knee and suck the fluid out, and that can help you restore your range of motion. Okay, so this is the bow-legged and the knock-kneed I was talking about. So if you wear out the inside part of your knee, it'll make you bow-legged like this. If you wear out the outside part of your knee, it'll make you knock-kneed. And this deformity can be corrected with surgery. So one thing that patients really like a lot is when you take the dressing down, like the day after surgery, they're like, oh, my leg's straight. So that's also a nice thing about the joint replacements. Okay, so physical exam. So you go to the doctor, and what's the doctor going to do? Well, they're going to test some things. They're going to look to see how well you can move the joint. They're going to see if moving the joint causes you any pain. They're going to look and see if there's any popping or clicking when you move the joint. They're going to look for any swelling. And they're going to look for any gait disturbance or typical limps that you'll see. And I've got some videos of those to kind of, sometimes we'll ask you to kind of walk back and forth down the hall so we can watch you walk, and that kind of helps us know what's going on too. Again, with the deformity, you also look to see if the joint, the knee is not straight, or with the hip, it can also make the leg shorter on that side that's affected with arthritis, and that can cause a limp too. Okay, so this is going to be a person that has hip arthritis, and this is a classic hip arthritis gait. It's called a Trendelenburg gait. So what happens is the hip will drop on the side because the muscles are weak. So if you watch her, you see how she's kind of doing like that, even though she's using the cane. So she's got a pretty bad one. But that's a pretty typical hip arthritis limp. Okay. This is one that's called a varus thrust. This is a guy that's a little bit knock-kneed, but it becomes even worse when he walks. The knee will actually shift out because the ligaments are stretched out. That's what you can see in this video.
Yep.
So watch his knee on the left-hand side. See how it kind of shoots out to the side when he walks? And he can't quite straighten it out all the way either. Watch it on the right side, you'll kind of see. So that can give you that feeling of instability, like it's going to give out. Okay, so after we do the physical exam, then we're going to take an x-ray of the joint and see what's going on. So the x-ray is just going to show you the bones. So this is a normal knee. So this is the end of the thigh bone, the top of the shin bone, and see there's space. Where the space is, there's cartilage. So if you look at this knee over here, you can see the bone is touching the bone on one side, and it's started to shift over. And then there's some bone spurs, these little sharp things that are sticking off on the sides. Same thing with the hip. The picture on the left, you've got a nice joint space, and then the one on the right, you can see the bone is touching the bone and there's no space there at all. So that also kind of helps us know what's going on. Okay. So what are we going to do about it? So the first thing you want to start with is non-operative treatment, right? Nobody wants to jump straight to surgery. So low impact exercise and weight loss are the two big ones. So there's a 5-to-1 ratio. in terms of weight in your joints. So particularly for your knee, for every pound you lose, that's like taking 5 pounds off your knee. So you lose 5 pounds, that's taking 25 pounds off your knee. I guarantee you, you will feel a difference going up and down the stairs. It makes a big difference. But it's hard to exercise when your joints hurt. So you kind of get caught in this catch-22. So what you want to do are low impact exercises. So like I talked about earlier, there's no blood supply to the cartilage. So you got to move that fluid around so you don't get stiff and you keep the cartilage that you've got left healthy. So you want to do things like biking, walking, swimming, and the elliptical machine. You don't want to do the treadmill, you don't want to run, and you don't want to do the stair climber. Those are all high impact exercises and they're very hard on your joints. So the goal is to relieve the pain so you can do the exercise, so if you need to lose weight, you can lose the weight. That's kind of the thinking here. So anti-inflammatories are the best thing to relieve arthritis pain. Not everybody can take them. If you're on Coumadin or blood thinners, you may have to try something else. But for the most part, most people can take these. These are ibuprofen, naproxen, celecoxib. The first two are over the counter. The third one is a prescription. The third one, celecoxib, supposedly causes less stomach upset. Some people can't tolerate taking ibuprofen or naproxen over the counter because it can cause some stomach upset. So you should always take it with some food. The other thing that you can do are injections. The first one is cortisone. We usually start with this. This acts like a local anti-inflammatory. So we combine it with some numbing medicine and inject this into the knee, and it acts like a local anti-inflammatory where it stays right in the knee, and it can help reduce swelling, it can decrease pain, which allows you to get out there and do whatever it is that you like to do. Hyaluronic acid, or the gel shot, or the chicken shot that you may have heard of. Hyaluronic acid is actually one of the components that's found in human cartilage. This works a little bit differently. It's a thicker kind of medicine, that's why we call it a gel. And the idea behind it is that it acts as a shock absorber and tries to open that space back up so the bone's not rubbing on the bone. So the cortisone will sometimes become less effective over time. So then we'll try these gel shots, and sometimes those work well for people. Other things that you can use are assistive devices. Women hate this when I tell them you should use a cane because women don't want to use a cane. But it really can help. It helps really to correct those gait abnormalities, and I'll show you a couple of videos about that, how that works. And then activity modification. You know, it's all about what you can accept. You know, if you used to run 5 miles a day, you may not be able to do that anymore with arthritis. And if you stop running, the pain may go away, but some people don't want to accept that. So it's all about, you know, what you want to do, what you want to get out of life, how you want to feel about it. Okay, so this is a lady that has hip arthritis, and she's going to show you the right way to use a cane. You're supposed to use the cane in the opposite side, and a lot of people have a hard time understanding that, but she'll show you how this works.
This patient is teaching the value of using a cane and the proper use of the cane.
I have arthritis in my right hip. I use a cane on my left hand, and that helps with the discomfort of the arthritis on my right hip. Once I get up, there's something about the pressure takes off the right hip if I use the cane in my left hand.
So it'll show her walking down the hall in a second. You can see it better. Okay, here we go. So you can see her limp's gone. So it can really help a lot.
I have arthritis in my right hip. I have my cane to help me on my left hand.
Okay.
That's the way it works.
So you try all these things. You modify your activities. You use a cane or a walker. You try anti-inflammatories. You try cortisone injections. You try the gel shots. You know, unfortunately, like I said with cartilage, once it's gone, it's gone. There's no way to put it back. So when those things don't work anymore and the arthritis has progressed enough, then it's time to start thinking about surgery. And at this point in time, it's a joint replacement. Like I said, unfortunately, we can't grow cartilage in the lab and stick it in your knee and make it live. We hadn't gotten there yet. We're working on it, but we're not there yet. So the damaged cartilage in the bone is removed and replaced with metal and plastic. And I've actually got some that you guys can pass around and look at. And these are what they look like. Yep. I don't know, I'm a big believer in like feeling things and touching things. That's how I learned, so you guys can play with those. And this is what the x-ray looks like. So this is a knee that's been replaced, so you can see the space has been restored. And that's that plastic part that's put in there. That doesn't show up on the x-ray, but the metal does. And then that's the hip joint over there that's been replaced. So questions that people commonly ask me, how long does the surgeries take? Knee replacement takes about an hour and a half, and so does the hip. It takes about an hour and a half. What do I need to do to get ready? Well, there's several things that you have to do. You have to be healthy enough for the surgery. So usually what we'll have you do is see your primary care doctor and let them clear you for surgery, and that just means a good physical exam. Get an EKG to check your heart, get a chest x-ray to check your lungs, get some blood work to make sure that everything's functioning well and that you can tolerate the surgery. We also have a joint replacement class where you meet the nurses and the physical therapists and the case managers who will be taking care of you in addition to the surgeon. And that's, I've found to be a really good thing because it kind of helps you get a game plan in your head. You know what to expect, the day of surgery, the day after surgery, and so on. So you kind of get in the right frame of mind for it. And show up, that's pretty much it. Okay, so will I be able to go home from the hospital right away? If you're super healthy and don't have any medical problems and a very motivated patient, we're actually doing joint replacements in the surgery center downstairs where you can go home the same day. So that's an option. If you think you need a little bit more help than that, we still do them at the hospital. Typically people are there for a day or two for a hip replacement, 2 or 3 days for a knee replacement, depending. After you're there, most people go home and they either have physical therapy come out to the house for a couple of weeks or they go straight to physical therapy in the outpatient setting. The other option is to go to rehab for a couple of weeks, and all of this depends on what other medical problems you have, how well you do after surgery, things like that. It's kind of have to go case by case basis and see which fits you. How long does it take to recover from the surgery? For a knee replacement, you can start driving, and usually you're walking without any kind of assistive device at 6 weeks, and you're usually back to your normal self at about 3 months. The hip is faster for whatever reason. I don't know why. I think because the therapy is easier, but usually at 6 weeks, people are doing pretty good. Yeah, Susan, my physical therapist, is back there like, yeah. The hip replacement is by far the best procedure we do as orthopedic surgeons. Like, that's my favorite thing to do because people immediately have that arthritis pain is gone the next day and they get up and walk around and they feel great. So that's a very gratifying procedure. Do I need physical therapy? Yes, you need physical therapy, especially for the knee, because the best predictor of what kind of range of motion you're going to have after surgery is what you had before surgery. So that's kind of your goal, if not better. But you have to work at it with a knee replacement. The first couple of weeks kind of stink. Okay, what are the parts made of? So the ones that we're passing around, so the knees are typically made out of cobalt chrome, and the plastic is made out of polyethylene, which is just a very highly machined piece of plastic, basically. But it doesn't wear out quickly is the main thing. It lasts about 15 to 20 years. The hips are typically made out of titanium and cobalt chrome, and then the ball of the hip that we use, there's a pink one and there's a metal one. The pink one is ceramic. We usually use that in our patients that are younger, 50s to 60s, because it doesn't really wear out at all. And then the liner is plastic. If you're more 75 to 80s, then we're probably going to use a metal ball, and that's perfectly fine. There's nothing wrong with that. But the goal is to do this procedure and do it once. Okay, so the knee replacement. So we talked about this a little bit, the physical therapy. That's the most important part of your recovery, in my opinion. If you don't do your physical therapy, you're going to end up with a stiff knee. It doesn't matter how well I put the parts in there. So a lot of that is on the patient. So just be aware of that and kind of get your game face ready when you get that done. Okay, so yep, those are the knee replacement parts. So that's the cobalt chrome that covers the end of the femur and that goes down into the tibia, and then the plastic or the polyethylene in the middle. And then that's the hip replacement. So the stem is titanium. The cup is actually cobalt chrome, and then that's a pink ball, so that's a ceramic one, but you can put a metal ball on there. And then the polyethylene, the plastic, actually goes inside the cup, so the ball articulates with it. That's it. That's all I got.